This is Thursday, late afternoon, evening, and I'm getting ready for my upper blepharoplasty, my upper eyelid surgery on Saturday. What I want to point out is what's going on here. You can see all of this redundant tissue here in my eyelid. I have a low brow. I'm not interested right now in a brow lift. I'm interested in just removing some of this excessive skin. My left eye looks worse than my right, but it's really because my right eyelid has a little eyelid ptosis. It's drooping a little bit. That is, the opening between the upper and the lower eyelid is narrower on my right side. So it actually probably looks like there's less skin. I'm a little bit, I'm excited. I'm a little bit nervous. I've been talking about doing this for about 18 to 20 years. And on Halloween, my team was telling me I was looking tired. So I had a laser under my eyes. And of course, then I started looking at things more carefully the way everybody does. And I thought, well, why not? Well, you know, now's a good time. So I'm 58 years old, and I think I'm ready to go. So I am concerned about a few things, I'll be honest. I want this done conservatively, the same way that I would perform it. I'm not really worried about it, but I do want to have that conversation. Particularly on the ptotic eye, I don't want to sculpt that too much because that potentially will make the ptosis more apparent. I also don't want incisions carried too far temporally. And these are adjustments that we make for men versus women. Again, I'm not worried about it, but these are things that are on my mind. Give you an idea of what I'm doing. That's my eyelid there. Yeah, I think, like I say, I think the time is right. So it's the night before surgery. You can see what's going on with my eyelids here. I'm excited. I'm a little bit anxious, to tell you the truth. I'm gonna do this under local with no sedation. No, often we'll give patients Valium, but I want to rest tomorrow afternoon and then be able to go out to dinner with him tomorrow night. Good morning. So slept in a little bit this morning, but I'm getting ready for my blepharoplasty. I'm a little bit, I'm excited. I'm a little bit nervous. I don't know why, but I think I understand what our patients go through. I am looking forward though to removing some of this tissue here, and as well, obviously on the right side. If you look real carefully, I do have a little ptosis in my right eye. That is, this lid is lower. I've explained that in other videos. That's different. That will not be corrected with the upper blepharoplasty, which will address the redundant skin here. Anyway, just wanted to get one video before we head in and get going. Well, I just underwent my upper blepharoplasty. I felt a little tiny injection on either side when the lidocaine with epinephrine went in. He used something called Y-Dace, which is the same thing that we use to remove high hyaluronic acids, that is injectable fillers sometimes, but that allowed the local to diffuse further. So literally I felt 2 injections, 1 on each side. During the procedure, I felt a little bit of heat at one point. He just re-injected a little more local. We talked and listened to music during the entire procedure. And so I'm gonna try to ice for several hours now so that we can make it to dinner later. But anyway, we'll follow this day by day. This is still 20 minutes following surgery, but I put my glasses on. You can see with my glasses, you can just about hide that incision anyway. We are seeing patients on Monday, so we'll see what they have to say. I'm about 2.5 hours post-surgery. I've been icing, following directions, and you can see a little bit of bruising creeping up there. I'll have to talk to the doctor about that. Anyway, so you can still see the white area here. This is from the epinephrine in the lidocaine solution, so that still hasn't worn off yet. And I'm trying to ice so that it doesn't bleed, but you can see a little bit of bruising. During the procedure, I think Scott talked about a little bruise over here that he thought wasn't going to occur, but anyway. 6 o'clock, I'm with my doc here. He's making a house call. We're having a little, what he did. So, a little swollen. I think it looks pretty good. Pretty good. He's very little ecchymosis, a little bit of swelling. He did mess up one side, but
but I'm going to deal with it. So this is us about 6:30, 6:15, day of surgery. Surgery was around 10:30, right? 10 hours following upper blepharoplasty with my doctor right here. We're out to dinner. Got a little bit of swelling, but looking pretty decent. Not too bad.
Good morning. This is day one following my upper eyelid surgery. Yesterday was pretty uneventful. I did rest and follow directions for part of the day, but I did go out to dinner last night and was walking probably more than I should have. Despite that, everything looked good. Obviously, I've got some bruising here, which is expected, and some swelling. One thing I did notice this morning is if you take a very close look at this eyelid here, it's actually dehisced a little bit. It's actually separated, and you can compare it to this one over here. This happens, and it happens sometimes, perhaps if we don't follow instructions, and it can happen anyway simply from just animating, raising your brows, or wiping it with your hands, or drying your hair, getting out of the shower, dressing, etc. So I'm not exactly sure what I'm going to do. I have some Aquaphor on there now, and for a small area, generally within a few days, the skin edges where things have separated will begin to contract, and it turns out absolutely fine. I'm considering putting a suture in there, but I haven't decided yet. But I am at the office. It's about 6 a.m. I got up at about 4:30 and checked myself out, and I'm here just because I'm not sure exactly how I'm going to address it yet. In the meantime, I'm feeling well. I'm trying not to be too expressive with my brow. This could be an advantage where maybe Botox was used initially so that someone couldn't raise their brows as much, but that's probably taking it further than necessary.
The Hissens package.
So yeah, right.
Here we are, Sunday morning at 7:45.
This is what happened when your surgeon is out drinking too much the night before.
Yeah. It was fine when we finished yesterday, you know. So
This is about 24 hours post-op, 11:30 Sunday morning, and beautiful day. I'm out here with my sunglasses on, trying to protect my eyes. You can see the incisions are a bit swollen and a little bit bruised, but doing pretty well. The eyelids themselves, yesterday it was funny, the eyebrows, as a local where I felt almost like you have a little bit of a headache in your eyebrow. I don't know if that's the best way I can describe it. The only thing I took one Tylenol, and I have not taken any antibiotics or steroids, even though we typically do prescribe them. I just got to it late. But anyway, so I'm just going to be real careful not to do anything dumb. I actually have the wrong kind of shirt on, but I am being very, very careful. It's very flexible to take off. I was very cautious taking a shower and drying off with a towel as well. My vision is fine. I've applied a little bit of Aquaphor. Perhaps I have a little less than I should. I underwent the dot laser back in October, and that was such a mess. I think I have an aversion to it, but actually everything's going well, and continue to follow up here. I know I put those back on, but that's what we got. May end up with a little bit of a crust along the incision here, and you can see there's a little suture in here. But what I'm gonna do is just sort of gently move this to sort of clean this crust. This itches a little bit, and sometimes getting this stuff clean is helpful. I want to be careful not to pull that stitch out. Sometimes it's good to wet it a little bit. We've got a little Aquaphor on there, so that's helping. And this is itching right here, but this is right where the stitch is, so you want to be careful. So that's what you can do to clean it, and also put just a little bit of Aquaphor over the area. Good morning. This is day 2. This is Monday morning. Good morning. I'm back in the office this morning on day 3 Yesterday was a little bit of a long day. My eyes itched. I'm not sure if I have any sensitivity to the Aquaphor, but I stopped that. A couple things I didn't do. I did not take antibiotics, and I did not take a Medrol dose pack, a light steroid, which we prescribe commonly for people. But anyway, so today my eyes have settled down a little bit. They were a little bit more red yesterday and dry. Otherwise, got some sleep. It still itches a little bit where the suture is, but overall, doing well. Back in the OR today. We're performing a couple of facelifts and blepharoplasties, so I'll continue to post throughout the day.
Good evening. Today is still day 3. Worked today, and things went very well. This evening, my lids are a little bit tired. I did notice something. I'm gonna set this down here. It looks like in the central aspect of my left eye, it's itching a fair amount, and I think that incision might have dehisced or separated just a little bit. The left eye, you can see, to me anyway, looks a bit more swollen and inflamed, probably secondary to that. What happens is the skin edge just can separate. I'm not the ideal patient, and being active, I think the skin edge just separated, and then what happens is your body senses that, well, it is a wound, it's an injury, and so all of these good wound healing factors, these platelet-derived growth factors, come to the area, and they set up a little, it's almost like a little crust. Sometimes you might see that on a wound as a whitish, yellowish, what we call an exudate, kind of a little crust area. People think that that's pus, but it's actually a very healthy exudate. That being said, it sort of sticks to your skin a little bit, and I think that can itch a little bit. As I said, I have not really followed the protocol that we recommend with a Medrol dose pack, which is a steroid, and I also have not been taking antibiotics, and all those are okay, but I'm thinking that perhaps I might find a little Benadryl or a light steroid, a few milligrams to take just to stop some of the itching. Tomorrow is going to be day 4. We're back in the operating room, and then at noon, actually Liz Bonus wants to do a story about blepharoplasty, so we sent her some of the intraoperative surgical photos, filmings, and a few photos from the past few days. So anyway, so hopefully I'll be ready for that, and we'll just continue this journey. I must say, once again, I am looking forward to the sutures being removed, which probably won't be until this weekend, but that's the update. Good morning. Today is day 4 post-blepharoplasty upper eyelid surgery. Last night, I think I was showing you that in the middle part of this eyelid, it dehisced a little bit, it separated. It looks like just by using bacitracin ointment, it is beginning to re-heal. It itches much less this morning already. Got another big day here. My vision is fine, there isn't any pain. I've been very careful with showers. It's hard not to rub your eye, getting out of the shower, drying your hair, that sort of thing, and dressing. But overall, moving along, I feel like I'm turning the corner, and so far so good. I did take another 4 milligrams, which is one of those little pills in the Medrol dose pack, last night, and perhaps that helped too. Good morning. This is post-operative day 5 from my upper blepharoplasty. And so I did use a little bit of the Lacrolube, a little bit of the gel for my eye yesterday. It seems like in the evenings after a long day, my eyes do feel a little more dry. Obviously, I can close my eyes just fine, and the importance of that is that the tears go over the cornea. So I'm not worried about dry eyes long term, but I am noticing in the evening that things get a little more irritated. Perhaps it's because I'm outside. Maybe there's something going on from an allergy standpoint. But overall, things are coming along pretty well. This left eye is a little bit more, just seems a little bit more inflamed, a little bit more bruised. That is where that dehiscence was. So a little bit of a delay there. But overall, back to work today, and we'll keep following up. Not much to report. Hello again, it is post-op day 5 from my blepharoplasty, and we just got out of the OR. You know, one of the nurses mentioned to me, perhaps it's that I'm operating. We've got fans blowing in there. It's dry, and because my eyes do sting a little bit, and this left eye you can see is a little bit more just inflamed overall. We've noticed that this right one's looking quite good. But my eyes do feel a little bit dry. I've used some drops this morning. Everything is really going well. There's not a lot to really show that's different, but you can see the swelling on the left side here, and I am looking forward to getting these sutures out. But overall, moving along. Good morning. This is post-operative day 6 from my upper blepharoplasty, and I'm not sleeping super well, probably because of the steroid, but eyes are looking better. I do have a little interrupted suture, one additional stitch there that I'm going to have Stephanie take out today, and I'll have the rest of the sutures taken out over the next couple of days. Overall, I'm doing well. My eyes are much less dry. I started using the drops a little bit more yesterday, and I did rest a little bit when I got home, just closed my eyes, which felt good. So anyway, there's not a lot to report with this procedure. Things are pretty straightforward, but we'll see how things go over the subsequent days.
Oh, that is tender. That is what's going on. What was bugging me?
It is pretty red now that I'm like looking at it real close.
Yeah, it's definitely inflamed.
Yeah.
Okay, thank you.
Good morning. This is 1 week out from my upper eyelid surgery, and you know, there hasn't been a whole lot to report. I will say that today you can see my left eye had one of the sutures removed yesterday, where it dehisced a little bit, but it was looking pretty good. It still looks pretty good, but it looks swollen, and you can see the eyelid itself looks smaller. The lid is heavier, a little bit more red on that side compared to the right side. And there's swelling more here. There's a little bit here as well. And we tell patients that, you know, even if I take a little mole off here, the swelling ends up getting trapped right along this area. And we're already a week out, but you can still see that there's still some edema, some swelling. Definitely though, this eye changed from yesterday. That is, it is more swollen. These things do fluctuate. I'm only a week out, and while a week seems like, you know, it might be a long time, I do say every day, every week, every month, things continue to improve. So I'm telling myself that too, because I was a little bit discouraged. I mean, I know what to expect. Needless to say, you know, I want my eyelids to look more bright. Still a lot of swelling, a little bit of bruising, mostly swelling down here. And we'll just see how the day progresses. Good afternoon. Today is Sunday. It is Father's Day, and I'm a week and a day out from my upper eyelid surgery. I'm progressing well. There's still a fair amount of swelling. I did leave that stitch, that suture in there. You can see a little bit here. And on this left eyelid where it had dehisced a little bit, it's a little bit more inflamed, but doing well overall. It's definitely a little bit of a process. My eyes are not dry finally, but they have been through the week. I've been using the drops. I did use a little Acrolube with the gel to place in my eyeball a couple of times at night. And it's a little bit tender still, right where the suture is. My sense is the skin is a bit inflamed, and it's healing around that. Tomorrow when it comes out, all that will happen is a little knot will be cut here, and this will just simply be slid out, and it'll probably feel good. In the meantime, I'll just continue to post updates. It's not terribly exciting, but because this eye is more swollen, we'll see how long it takes to settle down. It fluctuates when I'm outside, if the wind is blowing or the sun is shining. It does feel better still when I put some cold compresses on it. So we will continue to follow things. Today is Monday. I've had my sutures in now 8-9 days, and Nicole over here Just getting ready to take them out. I think this left one is buried a little bit. Suture removal day.
A little bit of pressure on your eye, pulling from this outside.
Good morning. It's been a pretty uneventful week. Today is Monday. I had surgery for my upper eyelids last Saturday, and I've tracked things day by day. There hasn't been a lot to share, but I will say there's a difference between my left side and my right side. My left side is the area that dehisced a little bit. It just so happens it also was a bit tender. I probably left the sutures in a little bit long. I did that thinking I'd be more active over the weekend, which I was, and I didn't want it to dehisce or separate again, either of them. But I think that it was healing so quickly that that the suture, it was tender. So you can still see it looks a little bit more swollen and red. I'm excited that that suture is out of there compared to the right side here, which is a little bit bruised, but doing well. Anyway, been functioning all week, operating, and we'll be back at it, but we will put together day by day recovery. Good morning. Today is day 10 after my upper eyelid surgery, and I'm starting to feel a lot better. If you look real carefully, I'll explain this in a different video, but prior to the surgery, if you looked at my eyelid, my eyelashes were sitting lower, that is over my pupil here. It's called eyelitosis. I have a little bit of eyelitosis. That's different than what the blepharoplasty addressed, which is the extra skin. Anyway, if you look carefully now at my left eye, it looks like this is ptotic or drooping. And from a patient perspective, it can be a little disconcerting because it looks like I've achieved a droopy eyelid. That's different than the extra skin that was removed. So anyway, that's one concern, and I'll talk about that more. What does that come from? It simply comes from edema, swelling. I know that during the procedure, the orbicularis oculi, the muscle, was not resected at all anyway. So I know definitively that there couldn't be what we call an iatrogenic, that is caused by the doc or caused by medicine, injury to it. And in this case, anyway, the cause of the ptosis is swelling. If you look at both of my eyelids also, there's a lot of edema. There's a lot of swelling in the lid itself. It's thicker. It's fatter than it was. And obviously that is expected. And I tell patients that all the time. On the receiving end of this, as from a patient perspective, that swelling can be a little disconcerting as well. It's one of those things. Is this, going to go away? When's it going to go away? To me, with all that swelling there, my eyelids, I keep saying they look more feminine. There's too much lid showing from my perspective at this point. And again, this is 10 days out. But that's a concern that patients go through, including myself. There's another thing. If you look at my right eyelid, I'm gonna try to close it here and point at the same time. But in the corner here, there is a little tiny bump that you might be able to see right here. Sometimes where the suture enters, and then it goes back and forth and it exits. In those two areas, a couple of things can happen. A little of the tissue can bunch temporarily, and I'm hopeful that's what we're seeing right now. But also some epithelial cells, some skin cells can get trapped. And when they do, what happens is we can develop what's called an epidermal inclusion cyst, or what we call a milia. And sometimes a discrete little tiny cyst can form in that area. 98% of the times, those things resolve spontaneously. Generally, the instruction is to start scrubbing a little bit more vigorously. I'm not going to do that yet because I'm only 10 days out, and because I already had this eyelid dehisce, I don't want to pull the incision open. So it's a little early for that anyway. I actually think one of the reasons why it may have formed in my case is because we did leave the suture in longer. Because of the dehiscence, the separation of this eyelid, I decided to leave it in 2 or 3 days longer, and I think that suture was irritating. In fact, I think that suture was very irritating for me in my left eyelid. It actually became a little bit tender. I don't know if that's because that it dehisced and there's just more inflammation as the tissue's trying to heal, or if I truly have a little sensitivity to the suture. Bottom line, it felt very good yesterday having it removed, and yesterday, last night, things felt a lot better. The other thing that I discovered is there definitely, for me, was more dryness. I don't have a strong history of allergies, that is environmental allergies. I also don't have any allergies to materials, latex, that sort of thing. But the disruption of the tear mechanism, and that is, there's a gland here called the lacrimal gland. When we blink, tears go over our cornea, drain into the puncta in our lower eyelid, into our nose, into the back of our throat. Well, anything that we do, whether or not it was the dot laser I had performed on Halloween, or whether or not it is a blepharoplasty, or anything that changes the blinking pattern, can alter the tear film and the tearing, and therefore you might experience that as dryness, and I certainly did throughout the week. It's been super hot here. Fans have been blowing both in the operating room and at home. I work with my head down a lot, so there's a lot of there's probably more pressure and more swelling created in my eyelids, which also might hinder the blink reflex. Bottom line, my eyes were more dry than I suspected. Of course, we know that happens. I've been using drops, and I used the ointment only once. That was maybe day 2. But these are some findings, some things that it's probably very good that I underwent this procedure and have a better idea of some of the nuances. In a way, I'm glad that it didn't go perfectly well, because I wouldn't really understand this as well. But we'll continue to follow. We're only day 10. Biggest thing, well, there are several things, but I want to make sure this eyelid pops back up, the edema subsides, and also that these bumps start to go away. So there's a bunch of things here still for me to hang in there with. Follow up soon. Hello, this is day 11 after my blepharoplasty, my upper eyelid surgery. I was looking at some photos earlier, and although things weren't bad and people asked why I was doing this, it really has made a difference already. I'll tell you that it's a great procedure. It's relatively easy. It truly is. I've been working and functioning quite normally. There are some things that I've shared in some prior videos. There's, this incision dehisced a little bit. It separated, so that created a little more inflammation. I've got a little tiny bump here. We see that. We call that a milia, epidermal occlusion cyst. There's a little bit of thickening of the incision here, still some bruising. Overall, it's coming along well. My eyes were dry. It's itchy. So there are some little nuances and some things that occur. I don't think they always occur. I'm told maybe I'm too sensitive, but anyway, I just wanted to give an update. I'm not quite, I'm 11 days out. So I've got some family coming to visit, so I'm excited to see. They are unaware that I've done this, so I'm curious if anyone will notice. One of them is my daughter, and the other is my brother and sister-in-law. So anyway, keep an update. Good morning. Today is day 13 following my upper blepharoplasty, and it's a little earlier. I've got a fair amount of swelling still in the upper eyelids, you can see, but things are coming along. Things are coming along pretty well. This eyelid here where it did dehisce, there is a little bit of thickness over that area. You can also see a little tiny bump out here, and the lid is numb. The lashes are a little bit numb. The right side here, you can see the incision, a little bit of thickness actually out here. But if this were the final result, I would be happy. But I know that there's a lot of edema, a lot of swelling in the lids. So like I always say, every day, every week, every month, things continue to get better. So I have a ways to go. Obviously, I'm functioning normally. My eyes are not dry any longer, and moving along pretty well.
Good morning. Today is day 19 or 20 from my upper eyelid surgery, and I just wanted to give an almost 3-week update. Overall, things continue to improve. You know, this isn't too exciting actually, but with my dehiscence, with the separation over here, you can still see how inflamed things are. There's some raised area, a little bit thickened, a couple little bumps. So I am managing it. It's a little distressing actually, only because the right side is looking so good. There is a little bruise up here, but overall I'm functioning very well. My eyes are not dry any longer, and I feel like I'm doing pretty well. I do realize after undergoing this again that it really is a challenge. You are hopeful that things heal perfectly well right off the bat. Anyway, I'm going to see some more family members and friends in the upcoming weekend, so I think that's probably got me a little bit anxious, just like our patients who are preparing for, you know, weddings or reunions and so forth. So anyway, all good. Thank you.
Okay, so I've been talking about the area that dehisced and where a suture came out here. It's still irritating me, and so sometimes what we'll do is we'll use a little Kenalog. I'm going to show you this here. It's a little Kenalog, and that's a steroid. We don't want to be too aggressive with it because we don't want to create an indentation in the skin. But it just like a steroid that you might take, like the Medrol dose pack we give it, which I didn't take, helps inflammation. So this is something you don't see every day, especially from somebody that doesn't like needles. But I'm going to see if I can inject this area. 1, 2. Good. I'm gonna try to come back at a slightly different angle. Yeah, I know I don't have gloves on, but it's me. Actually, it's not too bad.
Good morning. I'm a little over a month out from my upper eyelid surgery, and despite the little mishap early on with my left eyelid dehiscing, you can still see it's a little bit red, a little bit pink. It is interesting that I've seen one of my children, as well as my brothers, their significant others, my sister, and 2 good longtime friends on a recent trip. And nobody has said anything about my eyelids. I can understand where that might be a little bit disappointing in a sense, where you want somebody to see what's going on. On the other hand, the idea is to look more refreshed, and along those lines, my oldest brother, he was complaining about his own appearance and eyes looking tired. Out of the blue, he turns to me and says, "Your eyes look good." So, but still didn't notice anything surgical. If you take a real close look here, you're going to see some edema, some swelling in this portion of the lid. And you can see over here the way this is still red, but the lid itself remains swollen for some time. I always tell patients every day, every week, every month it continues to improve. So for me, I can still tell that I'm in a post-operative period, not just because of the redness of the incision, but because of the swelling, the edema in the lid. So that will continue to improve.
you know, I'm really just waiting this out. I'm trying to be patient. And obviously I've been functioning day to day very normally. So really nothing has changed. But when I do look in the mirror, when I get out of the shower in the morning, I see the redness over here, and I'm hopeful that that will move along a little bit faster. But overall, that's the update about a month out from my upper eyelids. It is now about 4 weeks and a few days following my upper eyelid surgery, and I must say that finally I am starting to feel much better about things. I had my eyelids done on a Saturday. My eyelid on the left dehisced, separated. My eyelid on the right has been doing very well from the beginning. And finally, the other day, even though this is still a little bit inflamed, it's settling down. It's not irritated, and it just feels a lot better. So patients often tell me that it takes about 4 to 6 weeks to sort of really feel comfortable with it. And just the other morning in the shower, I just realized that I could close my eyes. It didn't feel dry. It didn't feel irritated. I didn't feel tightness. And I really started to feel quite good. So I'm really happy with how things are turning out.